CTV's W5.
It was just a very grim sight.
Why were seniors' homes ground zero for the pandemic?
Public health authority are currently investigating.
It just happened so fast.
He looked like somebody had just left him there to die.
And
I had no control over my addiction.
playing the odds. But are you gambling with your life?
They describe a feeling of intoxication, of excitement.
It is a rigged system. Let's just call it for what it is.
Young people will be addicted, and some of them will die.
CTV's W5 with Avery Haynes.
Welcome to W5. How could so many seniors have been left to die in long-term care facilities during the pandemic? The scope of this tragedy was largely preventable, the result of a system that has been neglected for decades. And as Sandy Rinaldo has uncovered, even now, the lessons of the first 6 months have not been learned.
Today, more heartbreaking news. 3 more deaths linked to COVID-19.
COVID raged across the country with a vengeance, striking one senior's home after another. A national tragedy.
I've never seen anything this bad in 30 years.
The virus seemed unstoppable, so did the number of deaths.
The deaths continue to pile up.
From the first outbreak in March of 2020 at Lynn Valley Care Centre in Vancouver, to Pinecrest Nursing Home in Bobcaygeon, Ontario, to hundreds of other facilities. COVID killed nearly 7,000 seniors, destroying the lives of their families. This past June, the families of those who died at Orchard Villa in Pickering, Ontario, gathered together for a candlelight vigil. No care home was hit harder in Ontario than Orchard Villa, where 78 seniors died. Among them, 89-year-old Mary Walsh, whose daughter, Marie Tripp, was left to pick up the pieces.
You're still going through a period of mourning.
Mourning, anger. The anger is very, very hard to deal with. And
Who are you angry at?
the facility, the government, everybody that was above and in charge of taking care of my mom.
Mary Walsh had been admitted to Orchard Villa in 2019 with dementia. But Marie says right from the start, there were a litany of problems, among them, as these photos show, severe bruising.
They were improperly transferring my mom.
From the bed?
Bed to the wheelchair, from the wheelchair to the bed.
Okay.
Despite Marie's complaints, problems persisted. It got so bad, she made a demand.
And that was to put a camera in your mom's room.
Yes, but I didn't ask. I told them I was putting in a nanny cam.
Marie's video eyes would soon reveal something that shocked her when COVID struck the home.
What are we looking at?
We're looking at a PSW coming into the room, and I believe right here you can see that she doesn't have gloves on.
By the time these 3 videos were recorded, Orchard Villa was in the throes of the pandemic with 31 deaths. So it's even more troubling that some staff weren't wearing proper PPE.
In my opinion, there's no excuse for any caregivers not to be wearing and using proper PPEs.
A personal support worker who was at Orchard Villa before and during the pandemic agreed to talk to W5. We agreed to hide her identity and showed her Marie Tripp's video.
The hands of the PSW do not appear to be covered.
No, there are no gloves. Without a doubt, there's no gloves in this shot.
And yet this is at a time of COVID when PPE, including gloves, I should think, would have been mandatory, right?
Absolutely, yeah. That's just foolhardy.
Within days, Mary Walsh tested positive for the virus.
I've never seen such a rapid decline. It just happened so fast.
With Orchard Villa in lockdown and without their own nanny cams, most families watched from the outside, having no idea what was going on inside.
My dad would have been alone. My dad would have been scared. He was afraid of death.
June Morrison's 95-year-old father, George, had been at Orchard Villa since 2017, impaired by Alzheimer's, dementia, and Parkinson's. June was shocked when she phoned her father at the height of the pandemic in April. She couldn't believe her ears.
At that point, I heard coughing, and I asked my dad, is the man next to you coughing? And he said, yes, come and get me out of here right now. I made a request that the man or dad get moved, one or the other.
But 5 days later, George Morrison was still in the room, lying next to the coughing man who was now diagnosed with COVID and dying. His son video called June while fully outfitted in PPE. June screen grabbed these images.
And he explains to me he's in the room with his dying father. He panned the room to let me see my father in the other bed.
The very same day, as Marie Tripp remained glued to the nanny cam, the home reported that 11 residents had died. Mary Walsh was also in rough shape. She couldn't keep anything down.
I don't know how many times I was calling frantically trying to get Mom help because I didn't want her to aspirate.
Help finally arrived, but 24 hours later, things got worse.
So I got on the camera and zoomed in and realized how labored Mom's breathing was. Again, I'm trying to call frantically. They went down, I watched them put the oxygen on Mom. I know in my heart of hearts, if I hadn't had that camera and phone and say this, my mom would have passed on the Saturday.
Mary wouldn't survive much longer. 2 days later, she was gone, a victim of COVID.
You were with your mom when she passed away?
I was with my mom for the last 6 hours.
Did she know you were there?
I want to believe she did when I first got there and I was moistening her lips. I tried to kiss her through it with my mask and my full shield. I believe her soul and her heart knew I was there.
A measure of comfort for you during a horrible time when so many other families had to say goodbye through windows.
I can't imagine.
June Morrison had to say goodbye to her father over the phone. Suffering from malnutrition, he was transferred to hospital where it was discovered he also had COVID.
There was a moment where the nurse held his hand. Tell me about that.
That was the, just give me a moment. That was the Friday. So I said, can we try something? I'm going to ask you to place your hand in his left hand for me. Pretend it's my hand, and I'm going to ask him something. So I announced to him, my hand is in your left hand. Would you please let me know that you can hear me? Would you squeeze my hand for me? And he did that. So my dad would have believed it was me.
George and Mary were among the 80% of residents who got COVID-19 at Orchard Villa. 235 in all. 78 seniors would die. The situation was so overwhelming that late in April, the Canadian military was called in. Their damning report would cite the inappropriate use of PPE, patients left in soiled diapers, improper feeding, which may have led to a choking death, and much more. This PSW, who agreed to speak with W5, is not surprised by the military's findings.
Why do you think so many people died?
They didn't put a plan into place soon enough. They knew it was coming. You know, you don't start putting plans into place in April. You put those plans in place in January. You be ready.
In fact, many nursing homes across Canada that fared poorly did not have full pandemic plans in place and allowed staff to migrate between facilities.
We've heard that there were sick patients or those suspected of having COVID who weren't isolated.
There were lots of people that had COVID that weren't isolated. They didn't start isolating until it was too late. Their definition of isolation in some cases was just pulling the curtain around that particular resident.
What happened at Orchard Villa shouldn't have been a surprise. From 2015, when new owners Southbridge Care Homes took over, until COVID struck in March of 2020, government inspectors logged more than 120 violations, including alleged incidents of abuse and neglect. When COVID did hit Orchard Villa, Frontline staff like this PSW weren't prepared for what they saw.
Did you witness any deaths?
Yes. And there wasn't anything I could do, really, other than try to comfort him and try and keep him calm because he couldn't breathe. It's a terrible feeling because you feel so helpless.
So who do you blame for what happened at Orchard Villa?
I blame management.
W5 wanted to speak with Orchard Villa management, who deferred to the owners, Southbridge Care Homes. In a statement to W5, they acknowledged that staffing was a challenge, but said, "We took immediate action to implement all directives mandated by government and public health." No consolation for families whose loved ones perished at Orchard Villa.
I love yous. I miss you terribly.
Marie Tripp, whose mom, Mary Walsh, died there, is left with feelings of unresolved guilt and anger.
It's so heart-wrenching, and I can't wrap my mind around that this is how my mom had to die. I can't deal with it. It's just so hard.
Coming up,
the whole system failed.
A breakdown in care cost seniors their lives.
I only had so much. I couldn't do more.
When W5 continues.
Of the nearly 7,000 nursing home deaths reported across the country, the worst hit province was Quebec. And the city with the most COVID-related deaths was Montreal. With the situation at Maison Herron especially troubling. When residents began dying, staff were getting sick, and some even abandoned the home, afraid to get the virus. Wildly understaffed, public health authorities took over Maison Herron and made a desperate appeal for help.
We just looked at each other. We had no words.
Nurse Laura Dunamoulet was one of several volunteers who answered the call. What she saw still haunts her.
And what did you find when you walked into the rooms?
It was just a very grim sight. We removed the covers, the sheets, and they had been sitting in urine and feces for about 4 to 5 days.
They, so you're not talking about just one person, you're talking about the majority.
The majority. They must have been incontinent over and over again, where it traveled right up to the neck.
Oh.
As a nurse, you have to have a stomach for this, right, Sandy? But I was not prepared for this.
Not prepared, but determined to help more than 40 seniors, some who hadn't eaten or been washed in days, lying alone in their beds.
We were trying to clean them as gently as possible because the skin was going to come off. That's how inflamed it was.
Does it shock you that that's the scene you were presented with?
I wasn't shocked at all. I was just very, very saddened. I left and I sat in my car for 20 minutes and I cried, Sandy.
Cried also for the last resident she cared for that day.
I know the last patient you saw the day that you were there was a man with a situation that deeply touched you, John Whitehead.
He was 6 foot tall, Sandy. The bed wasn't long enough for him. He had sunken eyes, and he was so emaciated. And him again, he was just filled right up to his neck. But he was such a gentleman, and he said, "I'm hungry." And after one yogurt, he was licking his lips. He says, "Oh my God," he says, "that's so good." I only had so much. I couldn't do more.
W5 reached out to John Whitehead's family. We told his son Daryl and widow Roxanne about our interview with Laura Dunamoulet and the way she described John's condition.
That's disgusting. That's terrible.
You have to wonder what was going on in that home.
I can't imagine. It angers me.
Daryl Whitehead has wonderful memories of his 89-year-old dad.
My dad lived a full life, passionate about being a dentist and helping people.
But 15 years of Parkinson's disease had taken a toll on a man who had lived most of his life in relatively good health. He spent the last 2 years at Maison Herron.
What angers me the most is that after living a life like that, you end up spend your last days on earth just suffering and not cared for.
Almost 1 week after nurse Laura Dunamoulet tended to John Whitehead, the family got the dreaded call to come to the residence and say goodbye.
He looked like somebody had just left him there to die. And he squeezed my hand so tight, and I told him, don't worry. And I told him that he would make it through and be strong. And he was strong, so hopefully I didn't mislead him, but.
7 days after that visit, John Whitehead died of COVID without family by his side.
Who do you blame for the way your dad died?
I blame the whole system. The whole system failed. I blame the Herron. I blame them for covering up. They could have reached out and asked for help and saying a lot of our staff had left. Patients are not in good shape, but they obviously didn't care for them, the management.
On the same day John Whitehead passed away, Quebec's Premier, François Legault, spoke to the media, saying 31 residents had died at Maison Herron, 5 from COVID. His government claimed that the home's owners had withheld information about the actual number of deaths.
Public health authorities are currently investigating, and we've also asked for a police investigation.
Groupe Catassa, the owners of Maison Herron, have denied withholding information, saying they reached out for help, and the death count only increased after the health authority took over on March the 29th. That number would balloon to 43 COVID deaths. According to Laura Dunamoulet, who was there on March the 29th, there is plenty of blame to go around.
So somebody has to be accountable for this. The government and these private homes are just taking advantage of these seniors to the fullest extent.
Complaints about long-term care are not new. W5 has been looking at a litany of problems for almost a decade. From terrible negligence leading to resident injury and death.
And no one wants to see their parent like that.
To neglect in care homes leading to falls and bed sores.
Her back is raw, you can see her bones.
To abuse of residents by staff.
The PSW takes a feces-smeared cloth and shakes it near Helen's face.
COVID just served to highlight long-standing issues which set the stage for the spread of the virus. Pat Armstrong is a professor of sociology at York University in Toronto who specializes in long-term care.
Over the years, lots of investigations, lots of inquiries, lots of recommendations. The fact that this happened, the fact that so many seniors died during this COVID pandemic, who do you blame for that?
I think the government has responsibility. I think we have a responsibility. The number of people who move in and out of these places is huge, and that's at the core of this. Too few people who have full-time jobs.
Also under the spotlight, private ownership of seniors' residences, with research indicating more deaths in Ontario's for-profit homes at the height of the pandemic.
The pattern has been lower staffing levels, higher mortality deaths in the for-profit areas. So why do we put that money into profit rather than care?
Over the years, W5 has asked provincial health ministers whether they would fix the problems.
What are you doing to ensure this doesn't happen again?
And after COVID swept the country, W5 asked the government of Ontario, the second worst hit province, about the crisis in long-term care. The minister didn't agree to an interview, but in an email, her office acknowledged that changes are badly needed and that an independent commission has been launched to determine COVID's impact.
Huge tsunami of baby boomers getting older, fearful of what's going to be out there for them. Can we fix this in time?
I think it takes political will. I think we know what needs to be done. If that's not the case, we'll have another disaster.
In the meantime, frontline workers like Laura Dunamoulet are stepping up on behalf of seniors.
The caregivers are afraid to lose their job. They don't speak. Patients are not going to speak. They can't speak. I'm their voice today, Sandy.
And so Laura Dunna fulfills a wish to be a voice for John Whitehead and to meet the family of the man who had left such an impression.
Hi, Laura. Dara.
Hi.
Hi. How are you? We're managing. So happy to meet you.
You look so much like your father.
After you.
Thank you. How long were you with him?
I was with him, I would say a good hour.
Did he look like he was ready to pass on?
He was very emaciated.
But he was still cognizant.
I have to say he was the joy of the end of my evening. Yeah.
Thank you.
You're welcome.
Thank you.
We're gonna be there one day. And I wanna make that change for them today and for tomorrow for us.
Many long-term care facilities did protect their residents by having a pandemic plan, proper screening and PPE, and dedicated full-time staff.